The numbers are rising and so are the concerns, but the government says we could have been at a better place. Kenya has recorded 544 new COVID-19 patients, bringing the national count to over 19,100. Out of the 544 new cases or patients recorded today, 537 of those are Kenyans, while 7 are foreigners. 340 are male, while 204 are female, and 347 actually are meant to be 43, beg your pardon, just to get the math right, and 204 are female. And in Nairobi, to the county breakdown, it still stands as a county with the most registered infections, recording 326 new ones, followed by Kiambu at 51. Kajiado County has recorded 33, while Nakuru follows with 20. 113 patients have been discharged, bringing the total number of recoveries to 8,021. 12 people have succumbed to the virus, bringing the total fatality rate to 311. As the statistics continue to rise, the government says Kenya's curve is not flat, but is not too badly off. However, will this change when the mass testing resumes? Helen Aura is on the COVID-19 beat tonight.
Samburu is the only county yet to report a COVID-19 case, as West Pokot became the latest to report an infection. The Ministry of Health says the country is fully capable of combating the virus because the growth curve has a slow gradient.
The cases will come because they must go up, but they are coming at a pace that our health facilities are able to cope. We have continued to try and upscale our testing. One of the reasons why we had slowed down a little bit is because the reagents that we got has essentially been manual reagents. And when we have got the manual reagents, we cannot test as fast as we can with the automatic reagents.
Concern, however, continues to grow over the capacity of hospitals to handle the patients as the number of infections continue on the upward trajectory. The ministry says this concern is why it has adopted the home-based care plan, which is proving successful. And then there's the never-ending strain on healthcare workers.
We will continue to upscale the healthcare workers, to train, to protect. We have sufficient PPEs in this country. If there is a problem, it's probably a problem of management, problem of distribution, but most certainly not a problem of availability. And as you know, we have also allowed that counties can be able to buy and procure their own PPEs.
Currently, at least 634 healthcare workers have tested positive for the virus.
There are some health professionals who are misbehaving. You are the first line of defense. And if there is discipline required during times of war, the highest level of discipline is expected from frontline soldiers.
Nairobi County still leads in the number of cases. Baringo County has recorded 5 positive cases in Marigat town, making it the 45th county to record cases. Baringo Governor Stanley Kiptis has indicated that the county will scale up on mass target testing. With circumcision season approaching, the CS has urged Kenyans to refrain from going against the set guidelines to prevent the spread of COVID-19.
No such activity is to take place without the necessary protocols being developed, if indeed that will be the case. And the biggest question will be, what is better? Is it better to have a postponed initiation ceremony and have somebody to initiate, or carry out an initiation ceremony and kill our young men?
The youth have also been urged to adhere to the stipulated guidelines, as the trajectory of the cases among men is still alarming. Helen Aura, NTV.